Yeah.
Okay, so we have a motion second to open session.
Motion open.
Second. With a roll call, please.
Mr. Deal?
Yes.
Dr. Henry?
Yes.
Mr. Prater?
Yes.
Mr. Pig?
Yes.
Ms. Davis?
Yes.
Okay, we're back in open session. We'll discuss adopting a communicable disease order. In order to do that, we need to pass a resolution. So this is the resolution number 2112. Motion second to pass that resolution.
Motion to approve.
I amend that motion. Table it till the next meeting.
Motion second. Discussion.
In discussion, Mr. Chairman. For one thing, what we need to do, we can do without this. I feel like it's excessive and overburdensome to have all these extra orders, abilities to take someone to court, possibly tell people to stay home when they already know they need to because they don't feel good, so they're gonna stay home. I think we're forgetting that people have common sense. And if somebody's out and they're not supposed to be in their sick, somebody's gonna report them, and they're gonna be made to isolate, okay? But I don't think we need this. I think it's, I know it's my opinion, and I still have the floor. So some things that I think are egregious in this is that the department with this passing would be able to
Would still be able to.
it will tend to enhance the public health and prevent the entrance of infectious, contagious, communicable, or dangerous diseases into such county, and that it will give this board the right to pass orders, the health department to pass ordinances, and regulations.
We already have that.
This
We have
is
that
more
authority.
government overreach in our county to its citizens. And I say hell no on
Ms.
this.
Davis, can you please put your mask on?
And my
Our
mask,
staff were able to talk with
my
everyone.
mask is as good as it's gonna be, Miss Kelly Garner. Thank you.
The only thing I'd like
And,
to say, Ms. Davis, is that this order does not change anything to what's been happening. So I don't know why you're saying.
I think our county doesn't need to spend a bunch of time contact tracing anymore. I think we need to try to get everybody back to normal. I think all the numbers are coming down. I know we're still in the red, but that just, those are positive cases, not sick people necessarily.
Thank you. Yeah, that's your opinion. Any other discussion?
Yeah, this order is discussed excludes COVID-19. So I think that the point Ms. Davis is, she didn't specifically say COVID-19, but I think that's what she's trying to say. If you're talking about the numbers are coming down and things like that. Yes, sir. And this order doesn't affect what you were talking about.
As I understand, we're gonna put that in there, that it was originally in there, yes.
That's not what we're considering at this point. Okay, any other discussion? All in favor of passing resolution 21122101, please say aye. Aye. Opposed?
Hell no.
Excuse me.
So
Professional.
One. And I'm gonna officially
For the
set
record.
a special meeting for January 20th. What, it's a Thursday, okay. What time do you want to do that? For folks available that day?
And because it's a special,
January
that you
20,
can do
Thursday.
virtual attendance.
120.
I'm sorry, Christie.
So because it's a special, you can do virtual attendance. That helps people be able to get there.
Okay.
Would we be doing in the
We,
morning?
we,
or
we need
after?
our meeting set at 6:30 PM. What is the problem with that? That's what AG's office asked him us to do. 6:30 PM and in a larger building, such as the admin.
Never saw it specify a time or.
They didn't specify a time, but they said when people are working, they have to make a living. So they're asking us to do it at 6:30 PM.
And you mean people that work evenings?
Yeah.
Can't come?
Well, most of the people don't work evenings
We want to
and they want to.
I do think,
go ahead and set that as a virtual meeting on the 20th.
Because it's a special meeting.
Is that acceptable to everybody?
Yeah, that's fine.
Do that virtually. Okay, again, is there a good time for everybody?
send me a message.
Okay,
Morning's fine.
morning,
I'll figure it out.
okay. Yeah, could you set up a time, Kelly, please?
Yes, sir.
All right.
I make a motion to adjourn.
I have a motion in a second.
There's an item on the agenda that's not been addressed. You put me on the agenda to be able to speak.
It's out of order.
No, I did not.
It's out of order. I'm sorry, I have to leave the folks sign the previous engagement. I apologize.
Happy holidays.
Merry Christmas.
I asked you for a topic, you never responded to me.
You have me on there. You have me on the agenda. A board member to speak. Well, I just have a few things I wanted to mention.
This was out of order.
Do we still have a quorum?
Thank God. You don't need a quorum. We're not voting on anything.
So you need to have a quorum to keep the meeting going. You do have a quorum and Mr. Dealing, you had.
We have a quorum. So, for the record,
Ms. Davis, I was talking to the chair, please, okay? Mr. Dealing, you did tell Ms. Davis that she provided you with a statement of an idea of what she was going to say. She can have 3 minutes.
Let me get my timer going here.
Ms. Davis, please put your mask over your nose. If you need assistance helping to tighten it up so that it will stay there, I'm more than happy
please,
to help
Kelly,
you.
close your mouth for once.
I don't need to close my mouth.
All right.
I'm
Fine.
protecting the people
I'm
in this
fine, I'm
room.
healthy. I'm not gonna spread anything anyway.
Well,
so-
that's your opinion, Ms.
Yeah.
Davis.
You ready?
Please put your mask up if you would like your 3
Starting now.
minutes to speak.
Okay, what I'd like to say is that where we
What
are.
I would like to
from
say, Ms.
last
Davis,
year
is that we
to
would
this
need
year,
you to put your mask up or I'm going to have
And
you
we
escorted
are-
out of the building.
We're in better shape than we were last November, because in last November, we were much higher in all of the numbers, even though we are in the red, quote.
Quote.
It doesn't mean that we're not doing better this year than we were this time last year. So for example, I want to just, I've got a couple of these, if you want to see one there, and this one here for you. This page right here, it's current for Jefferson County. It compares us to St. Louis County, St. Charles County. Per 100,000 cases, we got about, per population, we've got about 60 people, average, that are testing positive. Doesn't mean they're sick people.
Ms.
doesn't mean
Davis,
they're
can I ask
dying
for that
people.
question again?
And
The number?
Mr. Chairman, she's interrupting me, and I only have 3 minutes, so
Yeah. 2
my
minutes.
thing is well over my nose. So in Jackson County, just for example, they've got about a 71, number 71 daily positive rate. They are at 65% vaccination. We're at 60 cases per day, which is just a few difference lower.
That is
okay?
inaccurate.
We're also in, this is COVID-19 now. It's very accurate.
What
It's
is the
from-
date of the publication?
It's today.
Code Act now, and it's saying that we have 60 cases.
It says that
It's
in Jefferson County, out of 230,000 people, cases per 100,000 is 60, which is 120 a week, okay? Anyway, we have the infection rate of 1.02. Here, and our mitigations and measures aren't as heavy as a place like St. Louis County. And their infection rate is basically the same as ours, 1.06, ours is 1.02. Jackson County, they have about 700,000 people, so this is per 100,000. They have a infection rate of 1.20. Their vaccinated percentage is at 65%. We're only at 49%. We're lower all the way around. So we're doing good, okay? So that was what I wanted to say on that. And the efficacy of the vaccines is not what they promised it would be. They said 95% efficacy. And if you look at who's in the hospital, it is showing that there's 25% of the people hospitalized are vaccinated people. Okay.
So how many
it's
does
not
that make
as-
for
it's not-
unvaccinated?
She's interrupting me. And so all I'm saying is that it's not the savior. And this all needs to be over with, okay? And the deaths are very low, and the chart shows compared now to last November to now, we're doing much better.
Okay, so we have a motion, second to adjourn.
Second.
Adjourn. Thanks, everybody.
Ms. Davis, did you vote?
Yes.